Community Health Worker Training, Cardiovascular Health, and Diabetes. Mini Module 7C, Diabetes Complications and Prevention of Complications. Learning outcomes for this mini module. We're going to continue to learn how to explain the steps in managing diabetes, explain complications of diabetes and how to prevent them, identify community health worker activities that create care connections for people at high risk for or with history of diabetes. Dangers of high blood sugar. So most of these dangers are when somebody's walking around with high blood sugar for quite a while. They're not sort of acute risks. So heart disease and stroke. Diabetics have 2 to 4 times higher risk of dying from heart disease or stroke than people who are not diabetic. Eye damage, that can lead to blindness. Kidney failure, and some diabetics end up having to go on dialysis. Infections, sometimes very serious infections, and neuropathy, which is tingling, pain, numbness, or weakness in the hands, feet, and limbs. Now we're going to go into a little bit more detail on each of those risks of diabetes and talk a bit about what diabetics can do to try to decrease those risks. So one of the problems of diabetes is that it can really decrease people's circulation, particularly to their feet, and it can cause nerve damage to the feet in particular. And both of those things together put diabetics at risk for foot infections and even needing to have toes or their feet or even part of their leg amputated. Some diabetics develop neuropathy, which is numbness or tingling, burning, and often pain in the hands, legs, and feet. Some diabetics cannot feel touch, heat, or cold well in their feet. This can lead to foot injuries because the person doesn't feel, when they're stepping on something like a little stone or when something's cutting them or when something's burning them. The feet can also become dry and cracked with thickened toenails and fungal infections. A diabetic who injures their foot has an increased risk of infection and ultimately an increased risk of amputation. There's a lot diabetics can do to prevent foot problems. Controlling blood glucose and not using tobacco can help protect the feet. Foot blisters, sores, infections, or ingrown toenails need to be seen by a doctor or a podiatrist, a foot doctor, right away. Also, on a daily basis, diabetics should take care of their feet in the following ways. Wash your feet daily with lukewarm water and soap. Dry the feet really well, especially in between the toes, because you can develop athlete's foot, which is a fungus in between the toes that for diabetics can become very serious. It can cause sores that become bigger and more problematic. Apply moisturizing lotion, but not between the toes. We want to, again, keep it dry between the toes. Check your feet for blisters, cuts, redness, anything that looks like it's the start of a breakdown of the skin of the feet. And if they're present, consult your doctor. Trim your toenails straight across and file the edge with a nail file rather than sort of cutting toward the corners of the nails, because that can cause ingrown toenails and infections. Change your socks daily. Avoid dirty or tight socks. Socks that have cotton in them absorb sweat better, and that helps to maintain the skin integrity of the foot. Never walk barefoot, either indoors or outdoors. And examine your shoes every day for cracks, stones, nails, anything that could injure the feet, and the feet may not feel it if you have neuropathy. The other thing related to that for women is to wear regular shoes, right? Not high-heeled shoes that are going to potentially damage the toes. Another risk for diabetics is with their eyes. Diabetic eye disease, which is also called diabetic retinopathy, is a serious problem that can lead to loss of sight. It causes difficulty with the vision when the small blood vessels of the eye develop weak spots over time. And symptoms of this include blurry or spotty vision. In some cases, it may come and go, but it can lead to blindness. One way to help prevent This problem is to keep the blood glucose and blood pressure under control. Finding and treating eye problems early can save sight. If you're having trouble reading, if your vision is blurred, or you're seeing rings around lights, dark spots, or flashing lights, you may have these eye problems. It would be important to call the doctor and make an appointment for an eye exam. Oral health is also very important because people with diabetes are more likely to have problems with their teeth and gums. High blood glucose over time can lead to infections of the gums and the bones that hold the teeth in place. It's important to care for your teeth and your gums every day to help keep them healthy. So brushing the teeth and flossing every day carefully. Keeping the blood glucose under control is important, and regular complete dental exams can help prevent dental disease. A diabetic should see their dentist right away if they're having trouble chewing or any signs of dental disease, including bad breath, a bad taste in your mouth, bleeding or sore gums, red or swollen gums, or sore or loose teeth. High levels of blood glucose can damage the heart and blood vessels over time, and this can lead to increased risk for heart attack and stroke. Many people with diabetes also have high blood pressure, which further increases their risk for heart attack, stroke, and other cardiovascular diseases. Diabetics should therefore be followed carefully for high blood pressure and should follow lifestyle guidelines to reduce their risk of heart disease and stroke. Again, fortunately, many of these guidelines are the same as the diabetes guidelines: a healthy diet, regular exercise, stop smoking, treat high blood pressure, treat high cholesterol. The kidneys can also be affected by diabetes. High blood glucose over time is very hard on the kidneys. And again, over time, they may stop working well or stop working entirely, a condition called kidney failure. Monitoring kidney function is critical. So the doctor will typically do both urine and blood tests to see how the kidneys are functioning. People with diabetes are also more susceptible to bladder and kidney infections. Controlling blood glucose can help prevent or delay the onset of kidney disease. Because diabetics are at such high risk for all of these complications, it's very important for them to have regular routine health care. So they should have a regular primary care doctor who is helping monitor and follow their diabetes. And in these regular office visits, which once the diabetes is under control, many people have these visits every 3 months, the doctor will review the patient's blood sugars, their medication and the levels of their medication, their diet, and their care plan in general. They'll do a blood pressure check. They'll do a foot check to see if there's any breakdown of any of the skin integrity anywhere on the feet, and a weight check. In addition, the diabetics should have their cholesterol checked yearly. They should go to an eye doctor to have their eye exam at least once a year. And this is not the type of eye exam that you can do like in a convenience store or at the drugstore. It's not just reading the eye chart. It's actually looking at the retina in the back of the eye. So you have to actually go to an eye doctor for it. You need to go to a dentist to have the teeth and gums checked at least once a year. Very important to get a flu shot because diabetics who get the flu can get much sicker from it. And to have a hemoglobin A1C checked at least twice a year. And the hemoglobin A1C is an average of the blood glucose level over the past 3 months. So it's a great snapshot of how well the diabetic's been controlling their blood glucoses over a 3-month period. It's important for diabetics to know their ABCs. A stands for the hemoglobin A1C test, B stands for blood pressure, and C stands for blood cholesterol. So it's important for the diabetic to know what their own numbers are for each of these things. So the hemoglobin A1C, the typical goal is to keep it below 7. Now, all of the number goals that are listed on here are kind of standard goals, but each person's doctor may set individual goals for them that are slightly different. So it would be important for the individual to talk to their doctor about what their goal is. But it's important to know the hemoglobin A1C because it tells you the average blood glucose over time. And you don't want those numbers to get too high because high blood glucose over time can cause all of the complications that we just talked about. The goal for blood pressure is to keep the blood pressure below 130/80. Because if the blood pressure gets too high, it makes the heart work harder and can cause a heart attack, stroke, and kidney disease. And it can be kind of a combined risk for some of those diabetes complications. And the C is for cholesterol. So remember that blood cholesterol is a type of fat that travels in the blood. There's good cholesterol, which is HDL, and bad cholesterol, which is LDL. The bad cholesterol, or LDL, can build up and clog the blood vessels, which can then cause a heart attack or a stroke. And the goal for the LDL is to keep it below 100. If it's too high, the doctor may put somebody on a medication to bring their cholesterol down, as well as encouraging them to decrease saturated fat and trans fats from their diet. And those are the type of fats that you get in processed foods and in meats and other animal products like dairy foods. Blood glucose testing or blood sugar testing is very important for diabetics. Blood sugar testing helps you understand how food, being active, and diabetes medicines affect your glucose levels. Testing can help you make choices every day about how to balance these three things. And it can also tell you when your glucose is too low or too high so you can treat the problem. By keeping your blood glucose levels close to normal, you can prevent or delay health problems caused by diabetes. So people who are told to test their blood glucose usually are asked to test it somewhere between 2 and 5 times a day. And usually they do it before breakfast, so a fasting blood sugar before they've had anything to eat, 2 hours after meals, and again before bed. In addition to those regular times of testing, a diabetic should test their blood sugar anytime they feel the symptoms of high blood sugar or low blood sugar. And then after they treat it, so maybe they have low blood sugar and they eat something to try to bring it up, then 15 minutes later they're going to test their blood sugar again to see if the treatment worked. It's very important to keep a log of blood sugars, because if your blood sugar is going too high or going too low at certain times of day, looking at that log can help your healthcare team figure out what's going on with you, right? Is it something to do with your diet? Is it something to do with the type of medication you're on or when you're exercising? So that's really important information for you to keep a log of and bring to your visits with your healthcare team. American Diabetes Association guidelines or targets for the blood sugar are a fasting blood sugar, so before breakfast, of somewhere between 70 to 130 milligrams per deciliter. And 1 to 2 hours after a meal, the blood sugar should be no more than 180. Again, your doctor may have slightly different targets for you, and you should talk to them about that. So people who are testing their blood sugar regularly are usually given a blood glucose meter or glucometer, and different glucometers work in slightly different ways. So each person should be trained on the particular one that they're going to use. They'll typically meet with a diabetes educator or a nurse who will show them exactly how to use the one that they're going to use. Click on this link here and it will show you how to use this particular one. Pretty much all glucometers require a drop of blood, and usually it's put on a little test strip, and then the monitor reads it, and it's a very quick test, right? Usually the reading comes back within about a minute. So go ahead and click on this and you can watch how it's done. In some settings, as a community health worker, you may be helping people to test their blood sugars or watching them do it to reinforce what they've learned from the healthcare professionals.
Testing your blood sugar is easy, even if you haven't done it before. You'll need the following things: the test strips and the meter, lancing device and the lancet, bandages, alcohol swabs, and cotton balls. Wash your hands. Use warm water to get your blood flowing. To make it easier, you can also let your hand hang down and shake it, then massage your finger before you prick it. Put the test strip into the meter. Most meters will tell you when it's ready for you to prick your finger. Decide which finger you're going to use. Don't use the same one each time. That will keep it from getting sore. Hold the lancing device to the side of your finger and press the trigger. Don't worry, it shouldn't really hurt. Squeeze your finger just a little to get a drop of blood. Gently touch the strip. It'll pick up the blood and let the meter show your blood sugar reading. If you get an error or you think something is wrong with your results, just wait a few minutes and test again. Check your instruction manual for troubleshooting errors. Apply a little pressure to get the bleeding to stop. Most people don't need to, but you can use a bandage if you want. Keep your kit handy so you can check your sugar whenever you need to. And keep a record of your blood sugar readings. It's good info to discuss with your doctor.
It's not uncommon for diabetics to have some times when their blood sugar goes too low or too high temporarily, either because of what they're eating or because of their medication, or in some cases when they get sick. So low blood sugar, which is also called hypoglycemia, is defined as a blood sugar reading below 70. And hypoglycemia can occur if a person eats less than usual, is much more active than usual, takes too much diabetes medicine. And this needs to be treated because you don't want it to keep going down. So you need to bring the blood sugar back up. The symptoms of hypoglycemia include headachesiness or tiredness. Sometimes people feel weak. They may start sweating or shaking. And sometimes they get really hungry, not surprisingly. Often people who have bouts of low blood sugar know exactly what that feeling is. And when they feel that, they should test their blood sugar right away. So if they test their blood sugar and it's under 70, they need to immediately drink or eat about 10 to 15 grams of carbohydrate. There's different ways they can get this. These are some of the kind of quickest ways for them to get it: to take 3 or 4 glucose tablets, to drink 4 ounces of either juice or soda. It's important for them not to drink diet soda because that won't help bring their blood sugar up. To have a cup of milk, 5 saltine crackers, or 2 tablespoons of raisins. They could have 4 teaspoons of either honey or sugar, or eat 3 to 5 pieces of hard candy. They're not going to do all of these. They're going to pick one of these, and then they're going to give it about 15 minutes to work, and then they're going to recheck their blood sugar. If the blood sugar is still low, they're going to repeat the whole process. Now, the opposite of that is high blood sugar or hyperglycemia. So that is defined as blood sugar above 140 milligrams per deciliter before meals. The blood sugar may be higher than that in the hour or two after somebody eats a meal. But if it's above 140, in between meals or before they've had anything to eat, that could be hyperglycemia. And that can happen when a person eats more than usual, is less active than usual, takes too little diabetes medicine, is sick, or is very stressed. So being sick or being stressed can sometimes make the blood sugar go up even if the person is doing everything else as they normally do. The signs of hyperglycemia include extreme thirst, hunger. Ironically, even if the blood sugar is high, the person may get very hungry. They may get a headache. They may have to urinate a lot. They may start to feel blurred vision. Their skin may feel dry, they may get very drowsy, and they may feel nauseous or sick to their stomach. Again, they're going to check their blood sugar if they feel this way. And if their blood sugar levels are repeatedly high, right? So on many days they're having high blood sugar, they need to consult their doctor to adapt their medication or their diet or their exercise plan, right? So something's not working right for them if they repeatedly have hyperglycemia, high blood glucose. But if it's very high, that can be an emergency. That can lead to something called diabetic ketoacidosis, which can be life-threatening. And so each diabetic should really ask their doctor when they should call for help. In other words, what blood glucose number they need to be aware of or nervous about if they get that reading. So for some people it might be 200, it might be 250, and the doctor can tell them, if your blood glucose is this number, you need to either call us right away or call 911, and to make a plan for that type of very high blood glucose reading. In both hypo and hyperglycemia, sometimes the person can become very confused and almost and lethargic, and in some cases, if it's really bad, non-responsive. And it's important for diabetics to let the people they work with or they live with know that they're diabetic, and that if either one of those two things happens, that they should test their blood sugar. If they have low blood sugar, they should give them some juice, for instance, or if they have very high blood sugar, they should call 911 if the person is unresponsive. One of the important things for diabetics to plan for is how to manage their diabetes when they're outside the house, so when they're at work or they're at school or they're traveling. One of the most important things they can do is to maintain a schedule for eating, activity, and medicines, and that means planning ahead. Okay, so they should plan their meals and their snacks ahead of time, especially when they're traveling, right? When they don't have complete control over, going into the kitchen for something to eat. They need to bring food with them so they can have control over what they eat and when they eat it. They should really be wearing an ID bracelet on their arm that says that they have diabetes, and especially if they're on insulin, because if they were to pass out, and let's say the ambulance comes and they have no idea that the person is diabetic, they may not immediately think of doing blood sugar testing to see if that's why they're having a problem. Again, they should tell the people around them, so people they see regularly at school or at work, how to help if they have dizziness or confusion from low blood sugar. And in some cases, they may want to actually write the plan down, meaning, specifically, give me a half a cup of juice, or give me, 4 hard candies that I keep in my backpack. They should carry snacks to prevent low blood sugar. So if they start feeling like they're low blood sugar, there should be a snack in their handbag that they can immediately take if they need it. They should carry candy or glucose tablets to treat low blood sugar quickly. They should bring blood glucose testing supplies with them, so even just to work or to school, but certainly if they're traveling, because if all of a sudden they feel like they're very low blood sugar, they want to be able to test right away. And if they are going to or are likely to need to take diabetic medicine when they're not at home, they should carry it with them in the original containers that have the name of the medicine and the dose of the medicine on it, as well as any supplies that they may need. So if they're taking insulin, for instance, they need to carry not only the insulin, but the syringe and alcohol wipes with them. So this is an interesting interview with a young man who was diagnosed as a type 2 diabetes, and he talks about his reaction to it and the changes that he made. And one of the most interesting things to me about this short video is that he recognized that he couldn't make these changes by himself. His partner is the one who shops and cooks for the family, and so she needed to be brought on board to make sure that she was buying and cooking food that was healthy for him. And the nice benefit of that is that it was also healthy for the rest of the family, making it less likely that anybody else in the family would develop diabetes. And also they all started exercising together as well. So go ahead and click on this and watch the video.
My name is Saul Tranquilino. I'm 34 and I have type 2 diabetes. And it's just that simple. I felt horrible. I mean, I just was sick all the time, even to the point where I couldn't eat, So I went to the doctor and I wasn't sleeping and, constantly going to the bathroom. So I said, I need to know what's wrong with me. They kind of knew already before they even did the blood test or anything like that. And that's what they did. And about a week later, they called me and told me I had type 2 diabetes. It wasn't tough to hear because I just wanted whatever was wrong with me to feel better because I felt so horrible. I mean, I can't even tell you exponentially how much better I feel just getting it under control, how bad I felt. The first thing I did was actually I got rid of all the pop in the house. That was the first thing. Like, I took it actually over to my brother's house, and I'm talking like cases of pop, you know, and then I told my family, and we just started a plan from there. Diet, exercise, things of that nature. Actually started looking online because I'm a technology guy, looking for apps that would help me, you know, watch what I'm doing, exercise, heart rate, things of that nature. And that was actually, I think, one of the first things we did. It's working out great. Like, I count my carbs and my calories all the time, and it's amazing when you start putting in the things that you're eating on paper or anything, how much stuff that you eat in a day, and it makes you feel bad, you know. For a little while, you know. Now I'm down to 1,100 calories and 150 carbs a day, you know, and it's not a problem. Now, at first I was hungry, but if I found, like, if I went and walk on the evenings or something like that, it tamped my appetite. Well, the first thing for me, and I was really big when I first started, was my first walk, I did it for 41 minutes. I only walked 1.5 miles. So it doesn't matter as long as you start somewhere, you know. And I was dreading it. Like, I'm sitting on the couch, I don't want to do this, you know. But eventually, you know, you just got to, you know, just try to, you know. One time, originally my goal was, they say a habit is 20, you do it 21 times, it's a habit. So I thought if I went out and walked 21 times, you know, in a month, I have a new habit. And that's pretty much how I started the program, just walking. Yeah. And that's all I still do now. I haven't tried to start jogging yet or anything like that. I just walk. And as long as my heart rate's up and I'm doing the right things, and it works. My nemesis actually is funny, is pizza. I can't live with, I mean, I just see it and it's just like, I just look at it and I just love it. Everything else I've been able to let go of. For example, we have vendors come in and they brought pizza. I actually left the building because I had one piece and I was like, I gotta go. So I went and took my lunch at that time and went and got something healthier to eat. Because I don't do a lot of the shopping at home, so it was very important that, you know, my significant other did a lot of label reading as well. And at first, we both did shopping together to know what we were getting into. And now that she does more of it, that's key. If she bought junk, I would eat the junk in the house. You know, what was ever quick and easy. So yeah, when we exercise, it's as a family, me, her, and both my kids. We both all do it together. So it's more of a lifestyle change as opposed to, we don't even call it diet at home. We just call it, we're eating healthier. They ask us why we have to work out, why we have to exercise, and we talk about getting all the bad junk out of your body and replenishing yourself with like waters and vegetables. It is very close because once you start keeping a food diary and they're looking at everything, because I mean the numbers don't lie, they look at what you eat, how you're eating, when you're eating, you know, what your sugar levels are. I mean, you can't look at a doctor and say, oh yeah, I'm doing everything just fine, and then give them the paperwork and it's completely opposite. So it's important that you like your dietitian and your doctor. It's probably the most important part for me, was that the ability to talk to them. Just stay positive. Just stay positive about it and make it more of a life experience as opposed to a hindrance in your life, because today I live normal. Nobody knows I have diabetes. When I'm walking around, nobody knows. Nobody's going to judge you for it. You know, you just have it, you know. And so if you just stay positive and include your family in it, I think most people will be just fine.
So what's the role of community health workers working with people with diabetes or with the community as a whole? Community health workers can help community members who are at risk of developing diabetes. So this really involves education and awareness programs, teach about the importance of healthy lifestyle choices, teach about the importance of eating a diet high in vegetables, fruit, and fiber, so generally healthy diets, teach about the importance of maintaining a healthy weight and staying active, teach about the importance of not smoking or using alcohol in any way, so chewing tobacco either, and about drinking alcohol only in moderation, And finally, teach people about how important it is to get screened for diabetes, especially people with risk factors. So especially, for instance, if people are overweight or if diabetes runs in their family. Now, in addition to all of those things, for people who have already been diagnosed with diabetes, community health workers should also teach about the importance of eating a balanced diet following diabetic diet principles. Teach about the importance of controlling blood glucose levels and taking medicines as directed. Support the person to test their blood glucose regularly, so help them to overcome any barriers that they've identified. And barriers could be anything from I'm afraid to stick myself, to I don't think it's important, to I can't afford the supplies, I don't have a safe place to do it. Could be anything. I can't remember what that nurse taught me. I can't remember how to do it, right? So really you want to see, are they able to test their blood glucose regularly? And if not, why not? And how can you support them to be able to do that? Similarly, are they taking their medication as directed? You want to help them to overcome any barriers to doing that. Teach them about the importance of seeing a doctor regularly for all of those screenings and follow-up that we talked about earlier. Involve the diabetics' family members to support them and help maintain a healthy diet, exercise, diabetes management, and regular doctor's visits. So getting the family on board is really important. And finally, link them to additional resources. That could be things like diabetic support groups. A lot of people find it's really helpful to talk to other diabetics who've already figured out how to do these things and can help them both figure it out and cheer them on. You might want to link them to a diabetes educator or a dietitian. Link them to walking groups or other kind of ways that they can get more physical activity, or to cooking classes, or in some cases, if they're having trouble affording their supplies, there are programs that can help them to either get free supplies or to get lower cost, to get help with affording those. And it's important. That's an important resource that you can help them identify and get linked to. Now you can explain the complications of diabetes and how to prevent them. Identify community health worker activities that create care connections for people at high risk for or with histories of diabetes. Congratulations on completing Module 7. Don't forget to go to the Google Classroom to complete the assessment for Module 7, Diabetes. The next module is Module 8, Healthy Eating, Weight Control, and Physical Activity.